Well, more than 5 million Americans are living with Alzheimer's disease, about 37,000 people in Nebraska.
It's heartbreaking and puzzling to know the numbers only grow each year. Alzheimer's is our focus in this week's Healthy at Home.
Yeah, from Advanced Home Healthcare, we're happy to welcome back Jessica Shaban. Thanks for coming in, Jessica.
Nice to see you.
Thank you.
And today, like we said, we're going to focus on Alzheimer's disease. You've seen it up close, firsthand. Describe what Alzheimer's does to someone.
Well, first off, Alzheimer's is a form of dementia, and it's a progressive, irreversible brain disorder. And typically it can range from 7 to 10 years affecting people. But personally, I've been affected. My grandmother passed away this year from Alzheimer's complications, and so it touches a special place with me. And that's kind of why I wanted to talk about it today.
How is another term we hear is dementia. I'm not really sure how it connects back to Alzheimer's, so what do we need to know there?
Dementia is more of an umbrella term that's used to describe the symptoms associated with cognition deficits and brain disorders. Think of it as the umbrella term, like I said, whereas Alzheimer's is a form of dementia. There are many forms of dementia, but Alzheimer's is the most common form.
Yeah, will you talk about your grandma? Can we revisit her a little bit?
Yeah, absolutely.
Yeah, there's some good pictures, but talk about what you experienced, you know, kind of caring for your grandmother a little bit and seeing her go through this.
Sure. My grandma was the matriarch of the family. She held a special place in all of our hearts. Never said an unkind word about anyone. Very loving and very generous, and we could see her change as the disease progressed. Started out with some of the typical warning signs, and then as things progressed, she was unable to recognize any of us and just was unable to function and do those activities of daily living, and eventually passed away this year.
The warning signs, I know that's something you want to educate our viewers on today.
Yes.
And so we have a list of these signs that maybe if it's you or someone you love and care about, this is sort of where you perk up and say it's time to ask a doctor.
Yes, and some of these signs in their lower forms can be associated with just normal aging. But some of the Alzheimer's warning signs are more significant. Memory loss is one of them, and significant memory loss.
So it's not just forgetting where you parked at the grocery store.
It's actually the inability to retrace your steps. Like, you know, where may I have set this comb? You're unable to retrace your steps of the morning, like walking down the hall into your bathroom. You're just unable to get back to the general area.
And then problem solving.
Yes, problem solving. Even things such as following a recipe in the kitchen or doing those daily tasks, you're just unable to remember the proper steps.
The things you've done a million times all of a sudden seem unfamiliar. We have more signs. So confusion.
Confusion with time or place. Alzheimer's affects the brain's sleep-wake cycle. So sometimes people with Alzheimer's have what's called sundowning, and basically at night or when their environment changes from light, they're unable to determine if it's day or night, and oftentimes they stay up all night.
Yeah, and then problems involving visual images and spatial relationships. What do you mean by that?
Well, sometimes the first signs of Alzheimer's are recognized as visual impairment. Like they may think, well, I need new glasses, or my eyesight's getting worse. Technically, that's associated with the brain disorder, you know, how visual...
The brain's getting confused from what the eyes are telling you.
Exactly. Yep.
And then finding the right word.
Yes, there are some times when they replace words, like instead of saying watch, they'll say hand clock, or they just have a hard time finding the right words for what they're trying to say.
And we have some more warning signs here. I'm curious, as we're looking at these, I don't want to run out of time to talk about treatment. So what's the state of medicine today, and what are the options for families?
Well, there are 4 FDA-approved drugs that deal with things associated with the brain's neuron transmissions. And there's also drugs that can be helped to decrease the symptoms of behavioral changes and mood changes that are associated with Alzheimer's.
But it's just sort of treating those symptoms, and as you said, there's no reversal.
Exactly. There's no cure. There's no reversal. It is an interesting fact, though, that those with type 2 diabetes are 4 times as likely to develop Alzheimer's. And some scientists are thinking this could be associated with higher blood sugar, and how sugar causes inflammation in the body, and that can be seen as inflammation in the
never
brain.
I haven't heard that either.
Yeah, that's new.
And so for caregivers out there, it can be difficult. But from the early stages, even to some of the middle stages, how can home health care help in a lot of these situations?
Well, first and foremost, we can care for the patients and care for those that are suffering from this disease, the early stages up until the late stages. But also something that's important for those to remember, we can offer respite care for family and caretakers, because these are the people that are really in the trenches, and they're getting frustrated and they don't know where to turn. My grandpa and grandma were married for 60 years, and it was so incredibly hard to see my grandpa deal with this. He lost the person that he had known for so long, since a young age. And it was important to be able to provide him with that respite care, even if just for a couple hours, where he could get out and go see some friends or go have some coffee, just a break.
Yeah.
So we can offer that.
And the starting point is a consultation, which is always free.
Yes.
So what
Yep.
do you cover there? What kinds of questions do you ask?
Well, we cover the whole gamut, and we always like family to be there also, so they can help answer questions. But we do a patient assessment, an environmental assessment, and if needed, we also contact the primary care physician to get specific orders if things should progress.
It's
So
all about
yeah, it
safety
is,
there.
and getting the family together, because it's a family-wide issue that people are trying to work on here. Advanced Home Healthcare, they can reach you at your website, or
Yep.
can they just give you a call? And both the information is right there.
Yep, advancedcareomaha@gmail and homehealthcareomaha.com.
And on Twitter and Facebook, so connecting with the young'uns. Thank you for coming in. This is such a, to share your story is special, but so many people relate, so thank you.
Thank you. Thank you
Thanks
for
a lot.
having me.
Here.
Appreciate
We'll
it.
see you next week.
All right.
Abby.